Okay, I have introduced myself to the patient. I've checked the orders, his wristband. He's given me his name and date of birth, and they all match the MAR. I've asked for allergies. He doesn't have any. He has not had any fainting spells. I've asked him if he has any concerns, and he has said no. So I'm going to explain the procedure. Mr. Monkey, the doctor has ordered fluids because you're dehydrated. This should only take a few moments. What hand is your non-dominant hand? Your left one? Okay, good. Have you had this done before? Oh, you have. Good. So you know what to expect, but I'll still go over everything and answer any questions you have. Where did they last do this? Oh, good. That's your cephalic vein that I'll be doing, and it runs along the side of your thumb. Was this a good location for you? Oh, it was. Good. It didn't interrupt texting or work or anything? No? Okay. Well, it doesn't look like you have any kidney issues, so using your non-dominant hand is a good idea. So we'll just use this site since you're used to it. When I'm done, just remember to report any problems you may have, such as redness, a red line running up your arm, swelling, or any kind of discomfort. Okay, I'm going to leave and go get my supplies. I'll be right back. Okay, so the supplies I have gathered is a sharps container. I've got my tape already ready to go. I've got it's supposed to be clear, but this is what I'll put over the IV site. I've got my cotton balls, got my flush to check patency, got gloves, I've got my pink 20 gauge needle I'll be using. Put this under my guy's arm. I've got a tourniquet and my alcohol pad. Everything is open and ready to go. So now I'm going to go over any questions they may have. He doesn't have any questions. He's done this before, so he's good to go. So I'm going to apply my tourniquet. I'm going to assess my vein. Okay, and I feel that it's spongy and non-pulsing, so it is a vein. So I'm going to remove my tourniquet. I'm going to wash my hands, do hand hygiene, and I'm going to put on my gloves. Okay, now I'm going to reapply the tourniquet. I'm going to wipe the area with my alcohol pad, starting from the middle, working my way out. I'm going to let that dry. Now with my non-dominant hand, I'm going to anchor the vein, and with my bevel up at about a 30-degree angle, I'm going to swiftly insert my needle. Okay, Mr. Monkey, you're going to feel a quick pinch. Go in. Really hard. My banana's not ripe, so it's a little hard. Now I'm going to just slightly pull back on my needle once I see the flash. See the flash, pull back on my needle. Now I'm going to use my finger and I'm going to continue to advance that catheter. Okay, I'm going to apply pressure above the catheter. Take my needle out to remove the tourniquet. Needle goes in sharp. So now I just have my my catheter here. So I have the pressure applied above it. I'm going to now attach my tubing, which has already been primed, as you can tell here. So I'm going to attach my tubing here. Okay, and now I'm going to flush it to ensure that it's a good, it's in there good, and it is. That's all good. Now I'm going to put a transparent dressing on it, and I'm going to make sure that I can still view the tip in the window. Um, I'm going to label the site with my initials, time, and date. This is my clear. Okay, everything looks good. I am now going to document that I used a pink 20 gauge into the cephalic vein, along with the rate and how many attempts that it took me to do it. And I'll come back and assess it in 15 minutes or so. And I'm going to check for phlebitis, infiltration, or just any other problems I see with it. So here I am back at 15 minutes. I'm looking at the location. Um, it was placed 15 minutes ago. The fluids are about a quarter of a way down, which is where it should be because it's going to be infused over an hour. I'm going to look at the condition of the dressing and the site. I don't see any kind of swelling, any redness. It's not uh, hot or cold to the touch. And yeah, there's no problems with it. So now I've got my order to remove it. So I have verified my order. I have done hand hygiene, put my gloves on. I've identified the patient again with his wristband, and I've asked him his name, date of birth, and everything matches. I'm going to turn off the infusion. I'm going to remove the tape towards the site, and I'm going to apply pressure once that tape is off, just above it. And then I'm going to remove, and I am going to put this in the sharps container. I know some places you probably don't have to do that, but that's handy for me. So I'm going to just hold some pressure on there for about 5 to 10 seconds. I'm going to inspect the site. Everything looks good. It's not continuing to bleed. I am then going to put a new cotton ball with my tape, and I'm going to have the patient apply pressure to that for 10 or 15 minutes. And then I'm going to document it, and I'm going to come back in 15 minutes just to make sure that that there's no problems with it. And everything is good. No problems. Thank you.